Hi, we're Group 10, and today we're going to talk about depression. These are the learning objectives. Recognize the causes, signs, and symptoms of depression and barriers to treatment. Discuss the impact of depression and the resulting burden on patients and the healthcare system. Elaborate on how depression affects community, primary, and hospital pharmacy care. And discuss how present and potential future roles of pharmacists can help improve patient outcomes for depression. So what is depression? According to the American Psychiatric Association, it is a common yet treatable medical condition that negatively affects how you feel, think, and act. Depression causes feelings of sadness or disinterest in activities once enjoyed. It can cause a variety of emotional and physical problems and can decrease a person's ability to function. So some common signs and symptoms of depression include a depressed mood, feelings of guilt or worthlessness, change in weight, sleep disturbances, loss of interest in usually enjoyed activities, decreased energy, thoughts of death, and poor concentration or difficulty making decisions. According to the American Psychiatric Association, the symptoms must last at least 2 weeks for a diagnosis of depression. People may be genetically predisposed to depression, and external factors can then increase their risk. These include death or illness of a friend or family member, problems at work or with a personal relationship, low self-esteem, financial difficulties, and addictions. Women can experience postpartum depression due to hormonal changes or depression during menopause. So who is at risk? Everyone can potentially be at risk for depression, but is less common in children. About 11% of men and 16% of women in Canada will experience depression in their lives, and women have consistently shown higher rates of depression than men. The prevalence of major depression has not significantly changed in Canada between the years 1994 and 2012, so the trend has been fairly consistent. Now we are going to talk about health status.
Patients may also have comorbidities. Depression is strongly correlated with long-term health conditions such as heart disease, obesity, dementia, arthritis, cancer, and AIDS. Having multiple health conditions or stress can also increase the chances of experiencing depression. Since depression is an illness that affects the mood of a patient, it can also lead to negative changes in patient attitudes, behaviors, and physical well-being. For example, patients may feel constant apathy, unhappiness, or anger. They may also have negative views of themselves, become disinterested in formerly pleasurable activities, or experience changes in appetite. Many studies have found that incorporating drug therapy, psychotherapy, and personal care into patient treatment plans provides the most benefit in treating depression. Drug therapy prevents recurrence and reduces the length of episodes of depression. However, patients may have to take medication for months for their first episode or years for recurrent episodes in order to see an improvement. Escitalopram and sertraline are considered some of the better drugs for treating depression based on effectiveness and patient tolerance. Escitalopram is usually taken 10 to 20 milligrams a day orally, while sertraline is usually taken 50 to 100 milligrams a day orally. However, the dosages may be different based on factors such as the number of medications patients are on and whether they have felt adverse effects to their drugs in the past. Psychotherapy is helpful in that it may decrease the number and severity of recurrent episodes. Examples of different types of this treatment include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. Psychotherapy aims to help patients identify factors leading to the experience of depressive symptoms and how to alleviate them, identify and change patients' negative ways of thinking that help lead to their mood disturbances, and improve patients' perception of having power over their own lives and regaining happiness. Finally, personal care is important. It is important for patients to recognize that depression is an illness and not something to be ashamed about, and to learn more about depression so they can better fight it. Joining support groups may also help them cope by giving them a chance to relate with others going through the same illness or receive advice from others who have had similar experiences. Finally, maintaining social interactions is important. These interactions may help alleviate the illness, while avoiding them can lead to the opposite effect. Now we are going to talk about the prevalence.
Globally, more than 300 million people of all ages suffer from depression, which is approximately 4% of the world's population. Prevalence rates vary by age and are highest in older adulthood. Globally, 27% of those with depression live in the Southeast Asia region and 21% in the Western Pacific region. 80% of those with depression live in low or middle income countries. In Canada, depression affects large numbers of people in all provinces. The rates are highest in Ontario and Quebec, the two largest provinces, followed by BC and Alberta. Globally, depression is ranked as the single largest contributor to non-fatal health loss. People with mental health disorders use hospital services more frequently, and 29% of emergency visits result in a hospital admission. In 2013 to 2014, BC spent more than $1.38 billion on services that directly address mental health and substance use. The impact on patients is that depression can cause the affected person to suffer greatly, resulting in disrupted work and school performance, limited ability to maintain relationships, and less interest in social activities. There is a negative stigma surrounding depression in the general public that may further significantly reduce a patient's quality of life and self-esteem. Less than 50% of those living in countries that are affected by depression receive effective treatments. This tells us that there needs to be more research into how to make effective treatments more accessible to patients all around the world. Depression can lead to suicide and is the 11th leading cause of death in Canada. Depression also accounts for 15 to 25% of all suicides in patients with mood disorders. So now we are going to talk about the 3 levels of care.
An article from CBC News released in 2016 discusses the cost of depression on the Canadian economy. So depression costs the economy at least $32.3 billion per year due to lost productivity. This is from both absenteeism, which is employees being away from work, and presenteeism, which is showing up for work while sick and having reduced productivity. Accommodation, food services, and the retail trade sectors are most affected as there's less job security and more turnover. Approximately 30% of all short and long-term disability claims are accounted for by mental illnesses. So this article highlights the fact that employers can benefit from being involved in their employees' well-being and addressing mental health issues. For community care, depression impacts it by increasing the number of prescriptions for antidepressants since there is an increasing prevalence. There's also an increase in possible drug therapy problems, such as drug-drug interactions and side effects. There's an increased need for private counseling from a pharmacist in a private area due to the sensitive nature of depression. There's a requirement for implementation of depression screening services, and community care requires pharmacist monitoring to ensure efficacy, safety, and adherence, so making sure that refills are obtained at appropriate intervals. For primary care, depression results in increased possible drug therapy problems, more complex patients since depression is a comorbidity for many diseases. There's also negative side effects from antidepressant medications, which could negatively influence other comorbidities. For example, a patient in a primary care facility who's suffering from depression and anxiety may experience negative side effects such as weight gain from their antidepressant medication, resulting in them being more stressed and anxious. There's also a requirement for pharmacist monitoring to ensure efficacy, safety, and adherence. For hospital care, there's an increase in possible drug therapy problems and an increased number of hospitalizations. There's also an increased need for interprofessional collaboration in order to provide personalized care, so teams involving physicians, pharmacists, psychiatrists, and nurses. There's also an increased need for monitoring since patients are admitted to the hospital and may have severe depression. There's an increased expense to hospitals due to costs of providing services, so medication administration, distribution, and staff. There's also a requirement for pharmacist monitoring to ensure efficacy, safety, and adherence. So now we will talk about how pharmacists can help.
Pharmacists can help people with depression in several ways. They are in a vital position, being the first point of contact patients have with the healthcare system. Patients often seek help from pharmacists first, as they are healthcare professionals that can give assistance without the long clinic lineups. They can note patients that recurrently come in for sleep aids, as this is an important indicator for patients at risk of depression. Pharmacists can ask specific leading questions about a patient's quality of life and refer those in need of drug therapy to a physician. They can also educate patients on the maintenance of good mental health. Patients can help fight depression by things like taking a break, focusing on relationships with friends and family, and taking time for enjoyable hobbies. Pharmacists can provide the public with information on depression by removing the stigma that someone is weak for suffering with depression. With respect to a patient's drug therapy, pharmacists play a very key role. They can provide detailed information on the medication, such as outlining the mechanism of action, side effects, interactions with the patient's other medications, and the onset of action of the drug. This can improve adherence to the medication, improving patient outcomes and saving the system money in the long run. It is important for pharmacists to allow patients to make their own educated choice on their own therapy. They can detail the pros and cons of each option, involving the patient in each step of the whole process. Pharmacists play an important role in monitoring patients for adherence, efficacy, and safety of therapy. Following up with patients strengthens the pharmacist-patient relationship and also improves patient outcomes. Now we will go over a clinical trial involving pharmacists in the treatment of depression.
In 2002, a randomized controlled trial was conducted to determine the effect of a new collaborative care model emphasizing the role of a trained clinical pharmacist in managing therapy for patients with depression in a primary care setting. Clinical pharmacists receive training under the supervision of a pharmacy psychiatrist to provide drug therapy management and education in patients diagnosed with depressive symptoms. 13 primary care providers were designated to refer patients to the study based on several criteria of depression. Patients assigned to the intervention group were interviewed and determined the severity of their mental health, identifying potential stressors, predisposing factors, medical, psychiatric, and drug therapy history. Patient education on symptoms, etiology, prognosis, and the role of antidepressants were discussed in detail from the first prescription drop-off to all other contact points between the patient and the intervention pharmacist. This included telephone calls and scheduled office visits. The randomized controlled trial compared the outcome of 75 patients treated with the new collaborative care model against 50 subjects receiving usual care to determine changes in drug adherence rates, potential outcomes, provider and patient satisfaction, and medical resource utilization. After a 6-month period, the intervention group demonstrated a significant increase in patient satisfaction, resource utilization, and drug adherence rates than that of the control group. No significant difference was found between groups regarding age and sex of the patients, and there was a greater decline in the number of visits to the GP for patients in the intervention group. Results from this trial suggest a favorable outcome for future studies on this model in other healthcare settings. We hope you learned more about depression, the impact on patient and the healthcare system, how depression impacts pharmacy care, and the role of the pharmacist. Thank you for listening to our presentation.